Okay. Good good morning and welcome to the Harlem Emergency Network COVID-19 update for what is today? September 23rd, 2020. Can you believe it?
Yeah, already.
hmm hmm So, we've been talking about this particular pandemic for 6 months now, and one of the things we've been saying over the summer was that people need to be concerned about a surge in the fall, and we said don't get complacent because the fall is going to come, and the experts are expecting to see another surge in this coronavirus. So, guess what? The surge is here. So, new daily confirmed cases in the U.S. have jumped by more than 15% in the last 10 days. Let's take a look at this graph from the New York Times. And the red line on the top, you can see that shows U.S. infections. And that's going from, mid mid March all the way up to now. You can see it went straight up and then it kind of eased off and then it went super up again. And that was when all those people in the South decided to ignore common sense and it shot up. And then you can see in the last few months it's been coming down steadily, steadily, steadily. Then all of a sudden, in the last 15 days, it's popped back up again. And so this is what we've been trying to tell people, and the reason why we're saying it's time to get back to protocols. And I want to say that these are not New York numbers. We haven't seen a spike yet here, but we're telling people um, don't be complacent because what happens in the rest of the country eventually gets to New York. It's like it's like everything. It's like movies, it's like plays, it's whatever's going on at some point in time it's coming to coming to Broadway. So um I don't know how many times we can say it, Carol.
Yeah, undoubtedly. And so many people are now traveling south and they're going to those cities and they're randomly being tested. Um, they've taken the precautions off of the planes. They're not sanitizing the planes like they were before. As a matter of fact, um, the president of the United States ordered that the planes no longer be sanitized as they were before.
Mhm.
So with so many people moving about, um, and now that there's still a possibility, we don't know where the school situation is going to be. People still may try to take that last route, go out of state. If they're not flying, they're driving.
Mhm.
But as of late, that situation in that at that wedding in Maine, that's very, very serious. It just shows just how quickly this can move and how it left a wedding and infected 110 people in other locations, jail and a nursing home, where you would have the most vulnerable people.
Mhm.
So let's not sleep on this.
That's the information. We can't say it enough. We can't stress it enough that it is time to go back to the basics. Whatever you were doing in March and April, you need to start doing it again. And it's time to get your supplies together. And because we don't know going into the fall, where it's going to go. We already know the problems that have occurred trying to open the schools up. And so that got delayed several times already. Supposedly, we're talking about next week, but we don't know because they've had to delay it two or three times already because of issues of not having the ventilators in the schools done, not having things disinfected, finding staff members who already have tested positive for COVID, and above all, they're dealing with a shortage of teachers and a shortage of resources for operating remotely. So we've already um, talked at length about the issues with the school system, and we'll continue to follow that. But the basic message is still the same: is that while you're on your own, you've got to be able to take care of yourself and manage yourself during this crisis, and not act like it's over when we're just when there's another chapter of this that it looks like is on the horizon.
Right. And then again, even if the school's open, you have
Mhm.
to pay particular attention now to
Mhm.
your children.
Mhm.
They did not cease to be super breeders. So
Mhm.
you have to pay extra attention to them. You don't know who they're around. As they said, there's not enough staffing, and it's really doubtful that there will be enough staffing because that was something that was talked about last month.
Mhm.
And additional staffing is not being added, and more staffers in those locations where people have tested positive, those going to, for the pre-opening that were going in-house,
Mhm.
testing positive. And so other people were saying, hey, it's here. I'm not going back to work. So that lessens the amount of staff that you have. So you
Mhm.
have to be very, very, very careful and
Yeah.
pay attention to not only your children, but other people in the household, even your spouse. People are going to be moving around a lot more. Your child is coming in, they're going out. You have to pay more attention. Look for symptoms and act
Abs-
accordingly.
absolutely. So there's another story we want to talk about, and that is I call it "Don't use the A word." The CDC and the WHO seem to be avoiding what we call the A word, and the A word is aerosol. And so when the word aerosol is used to talk about COVID 19, they're talking about the fact that it spreads when the particles are aerosolized. And what that means is that the particles are small enough to travel in the air, and that travel is much more than a six foot distance. And so the CDC last Friday, um, after many, many months, and many other experts have already talked about the fact that the virus is aerosol. So the CDC finally came out on their website to say that it was aerosol, and I got some of this information coverage I've got from Dr. John Campbell, who has a YouTube channel where he reports regularly on COVID globally every day, and he follows all the research and all the science. And so he was reporting how um, the CDC made it clear that the virus is airborne. They used to say it was less than 6 feet, and they finally came out and said that infection breathing infected particles can travel further than 6 feet, and they used the word aerosolized. And that was last Friday. And then what happened? They came out on Monday and they removed the information from their website, and they put up a statement saying, "Oh, this information, a draft version of proposed changes to these recommendations, was posted in error to the agency's official website, and CDC is currently updating its recommendations regarding airborne transmissions, blah, blah, blah." So they finally got in line with all of the scientists in the world, and then all of a sudden they took it off their website. And so, to put this in perspective, this issue is so important that 239 scientists signed an open letter appealing to the medical community to basically, you know, make it recognize that the virus is airborne, and that's how it spreads. This is how important these scientists thought it was because they were concerned about these issues about these organizing bodies not recognizing that this is how it spreads, and so that's how important it was to the scientists. Now we want to dig into this a little further by recognizing what's also been going on in terms of um, a grab for power in terms of the Trump administration in terms of who talks about these things. So the Secretary of Health and Human Services, Alex Azar, um, basically came out with a memo also last week barring any of the other agencies, including the Food and Drug Administration and the CDC, from signing any new rules regarding the nation's foods, medicines, medical devices, and other products, including vaccines. And so he put forward a memorandum saying that he's the only one who can talk about these things. And so let's talk a little bit about who is this uh, gentleman, Alex Azar, who is now basically in charge. He's the number one guy in charge of talking about medical things for this administration. So Alex Azar is not a doctor; he's a lawyer. Um, and so he has worked in the Department of Health and Human Services for years. He worked there from 2001 to 2005. He was the top lawyer there. But then he left when the Obama administration came in, and he went to work for Eli Lilly, one of the top pharmaceutical companies. He eventually ended up being first the top lobbyist for Eli Lilly, and then eventually became president of the U.S. division, where one of his major accomplishments was tripling the price of insulin. So this is a person who's never he's been an opponent of the Affordable Care Act, also known as Obamacare, an opponent of abortion. He's been pretty much on all of the right wing um, uh, platforms, but he's also been an unapologetic um, champion for the pharmaceuticals, not the people. And so this is the man who is now dictating policy. And so what it does for us is it has to cause us to be concerned with, at this point in time, the quality of any of the information coming out. And so when we tell you that um, coronavirus outbreaks have jumped 15% in 10 days, that's not even assuming what we think is a certain amount of undercounting, because there's also information that the data coming in is not consistent, and there's probably a lot of situations where things are not being counted properly. So even with the suspicion about the data, we've seen a 15% jump in 10 days. And right now we're at a position where obviously we're doing a lot more testing than we were 6 months ago. So, we're not getting a jump because we're doing more testing, because we've been doing the testing now consistently. So the jump comes from an actual increase in cases that has come out of the blue after we had seen, at least a consistent decline since I would say maybe early July to now. The numbers have been going down, and now they pop back up again. So we've got two problems. One is more COVID 19, and the other is that we right now have an administration which hopefully will be able to change by the beginning of the year, but right now is not giving us information that we can trust.
So we're talking about a lawyer who was on hospital administrative boards doing
Hmm.
the legal stuff,
Hmm.
who obviously, in this president's mind, that qualifies him to give medical advice.
Mm-hmm.
Man, a public emergency. That's like saying I was a clerk in a hospital for 25 years, and that should automatically um, enable me to go in and be a surgical nurse.
Mm-hmm.
You know, I mean, this is, I don't know about anybody else. There's not a lot that scares me, but this administration scares me more than the virus.
Mm-hmm.
This person has allowed 200,000 people, that is a fifth of a million people, to die
Mm-hmm.
from this disease. He admittedly told you that. Now he's put a lawyer in charge of all of the information. This man is supposed to vet and make sure that everything that comes out of his office is correct. He's taken all of the protocols off of making sure that buildings or planes that you're traveling on, different things are being sanitized. It appears that he's doing everything to increase those numbers. Now, I know that there was the conversation that all of the cases of people that died weren't COVID, but let's say it plainly. If 100,000 people out of 200,000 people actually died of COVID, that is 100,000 too many. And that came from the person who is heading, I have to keep using quotes, heading this country.
It's crazy. Crazy. So the other thing I want to talk about is that there is a story.
Can I say
Um,
something to that?
absolutely.
Um, like that individual, obviously there's something wrong with him. But what about the Senate and the rest of the people that are allowing him and following him and pushing him on to do this? These are the people that are really responsible because he could not do that if he did not have the support. So I feel that it's the people, that 40% that is pushing him on, that Senate that is completely quiet to everything that he does, these are the people that are really, really responsible. Because when a person is sick, they don't know what they're doing. I mean, he's to the point where he knows what he's doing, but he's sick. Now, you're going to let a sick person just lead you and lead you and lead you. Something's wrong, deeper than him.
Absolutely. That's why we have to vote. We have to get out, black, brown people, indigenous people. We have to vote. And we need to stop the nonsense. Stop worrying about what somebody did 40 years ago. You are looking at a total disaster running, operating in a disaster, controlling a disaster. Because even as the president, he has the right to veto this stuff. And he's making no qualms because they're doing what he wants them to do. So we have to get out there and we need to vote because before there was a saying where vote as if your life depends on it. Vote because your life does depend on it. Now we are already looking at these surges. So let's look at another fact. A lot of the testing sites in black and brown communities that were scarce before are closing down. And now we're going into a lockdown phase because it's getting colder. People are going to be locked in more. But a lot of those fights that we fought for in black and brown communities in Harlem, it took months after this disease was surging before we got testing sites. And now most of them are closing. They're doing something called pop-ups. No one knows where they are. They're only there for 2 or 3 days and then they disappear. So we've only got maybe 3 sites, like I know in East Harlem, 3 sites. The other ones are gone. So they're even making it more difficult for you now in this next phase to even be tested. So that's up to us. Like we were taught the yo-yo method, you're on your own. You have to be vigilant and fight for yourself and your family.
There it is. So, what do you need to be doing now? Right now, you need to tune your immune. Go back to the basics. Vitamin C, vitamin D, zinc, fresh fruits and vegetables, um, turmeric, garlic, magnesium, selenium. There's a lot of things you can take, but start with the basics. You know, we've been talking about vitamin D since March, and the rest of the world has caught up to us with the research. You know, so it's not a secret anymore that a vast majority of the people who died from COVID-19 were vitamin D deficient. So, what is the best thing that you want to not be? Vitamin D deficient. Now, during the summer, we have access to the best source of vitamin D in the world, which is the sun. And a lot of us got out there and we got our vitamin D, and that's great. But we're going into the fall. We're not going to be outside as much. We're not going to have as much access to the sun. Black and brown people have a more of a tendency to be vitamin D deficient because the same melanin that protects us from the ill effects of the sun and the ultraviolet rays, it also makes it a little bit more difficult for the vitamin D to be processed in our bodies. It didn't bother us as much when our ancestors were in those warmer climates because the sun is hotter and we still got the vitamin D. But in northern climates, black and brown people must pay attention to their vitamin D levels. So one of the things that we will be continue to talk about is the absolute absence of our health officials in talking about vitamin D as a major health issue. I do not know why our Department of Health, why the mayor, and why the governor are not advocating for the use of vitamin D by all people. I do not know why it is not it should be a known fact that every black and brown person that goes to the doctor needs to get their vitamin D levels checked and tested. It's a simple test. They do the blood work. Wally, you can talk a little bit about that because because of the information you shared, you started to get those tests. So, can you talk a little bit about your experience with your doctor and vitamin D?
Yes, I was suffering, and I'm still kind of suffering from a, uh, uh, a nervous shaking in my left hand. So I went to a holistic doctor, and one of the things that they mentioned to me was that I need to check my vitamin D. They asked me, did I do it? So I said no. Now, I have been going to the VA for many, many, many years, over 15 years, and I get a check almost sometimes twice a year, sometimes 3 times a year. And I finally went and asked them to check my vitamin D, and sure enough, it was deficient. And then since I asked them to check it, now they approaching me as if they told me to check it. You know, so you have to go to the doctor. When you go to the doctor, you have to ask them to check it because they're not checking it. They take all these blood samples from you, and vitamin D is not one of them as a routine method. So
So there you have it. So,
mhm.
so vitamin D is easy to find in the stores. You can also find it from food sources. So you can get it from butter. You can get it from cod liver oil. You can get it from eggs, halibut liver oil, herring, mackerel. Meat has vitamin D in it. Milk has vitamin D. Salmon, sardines, they're all good sources of vitamin D. So these are things to make sure they're in your diet. But you should definitely, if you're going to the doctor, find out where your levels are so you can know exactly. Because if you know where your levels are, now you can be very, very exact. If you need to take supplements, you can know exactly how much you can take and what it's going to do. But in any case, you can still go to any pharmacy or health food store and find vitamin D capsules and make sure that you get it in your system. It's that simple. Save your life. And not just vitamin D, vitamin C also, and zinc. These are your three best friends in terms of boosting your immune system. Now there's many food sources that have these things, and you know about them. You've heard about elderberry. Elderberry is very high in vitamin C. You've heard about turmeric and ginger and moringa, and we have a lot of healers in our culture and community. And so I'm not suggesting you have to take the a lime. Limes are very good sources, and limes are cheap. You can, if you go uptown, you can find sometimes fine limes. You know, five for a dollar, 10 for a dollar. You know, you take those limes, you cut it up, and you drink lime juice all day, and you're filling your body with vitamin C, which will protect you. And so you need to start this not tomorrow, not next week. Start it today. Start boosting your immune system, and you're going to continue this until the until we no longer have a COVID-19 problem. And if you don't want to continue it, you can expose yourself to it. But I would recommend that you don't want to get this disease. Um, and if you get it, you want to make sure your body can handle it. Because as we do know, you know, many people recover from this, but how they recover is a different thing. So a mask is only the first line of defense. That's that's like, that's the front of down the street trying to block it. But if it gets past the mask, what are you gonna do? What is your plan? Your plan has to be to boost your immune system and let your body do what it's supposed to do. And let's be very clear. Everybody's talking about the magic vaccine that they're working so hard to get. So there's two things we need to remember about vaccines. Number one, vaccines are very effective for things like measles and smallpox and polio. Those vaccines have been very effective. What about the last few major health challenges that we've had that were viral in nature? Um, was there an AIDS vaccine? No. Was there a vaccine for the first SARS virus? Because COVID 19 is basically the second variation of the SARS virus. They didn't have a vaccine for that. Did they have a vaccine for Ebola? No. So we don't know that they're going to come out with a vaccine. We don't know that the vaccine is going to be effective because we're talking about a virus that mutates. But even if the vaccine works, understand that the way vaccines work is only to help the body actually defend it. The vaccine is only there to help the body recognize that particular virus. But the body's defense mechanisms are the only thing that save you from COVID 19. So, my question is, if your body ultimately has to do the hard work, why don't you help it now to do the work instead of waiting for some magical pill or magical vaccine to come? And we just don't know. And we have, we talked about this earlier. So, right now, running um, our government for COVID 19 is somebody who used to be the president of one of the biggest pharmaceutical manufacturers. Their biggest concern is not your health, but their money. And they regard this uh, virus as one of the biggest opportunities that they've ever had. So that's great for them and their shareholders. Doesn't mean anything for the safety of you and your family. So what we're talking about is what is the opportunity for you to be safe and be healthy. And that comes with boosting your immune system so that your body can do the fight. And remember this, your body is the only thing that can beat COVID 19. A vaccine, all it does is point the body in the right direction to say that's the virus. Now you go do the hard work. So why don't you help your body today do the hard work by getting your vitamin D, getting your vitamin C, which you can get from aloe vera juice, blackcurrant, broccoli, Brussels sprouts, cabbage, cauliflower, citrus fruits, collard greens. Did you know that collard greens had vitamin C in there? You probably didn't know that. You might want to cook up a bunch of greens today. Get that vitamin C. You might want to get some of the vitamin E that comes from almonds and apricot oil and cottonseed oil, eggs, hazelnut, leafy green vegetables. Get these things in your system. And this is science that's been proven for 80, 90 years. We know that these nutrients have been effective in helping your body. So don't let somebody talk you out of it now. Oh, that's just vitamins. They don't really work. Of course they work. We've been hearing that from our mothers and our grandmothers for our entire lives. And I don't care how old you are, you heard about vitamin C because they started promoting vitamin C in the 30s. So
Yeah.
there's nobody here right now in our country who has not understood that vitamin D, vitamin C, these were things were important for our health. So don't let anybody talk you into anything that is not the most important thing you can do right now.
Yeah, and I ride up and down the street and I see pumpkin seed shells and sunflower seed shells up and down the street in Harlem. So I,
Mhm.
if you want to give your kid a healthy snack, there's seeds.
Mhm.
Kids love seeds, you know. Um, and that's it, really, in a nutshell. It's all on us. What are we going to do to take care of ourselves?
Mhm.
This is not something you want to play Russian roulette with, and that's exactly what it is. We still have to focus on social distancing,
Mhm.
and it seems like now people are just wearing the mask with gaps in it, and they have ceased to socially distance. I'm having
Mhm.
a situation in my building all the time. My elevator is not 6 feet long.
Mhm.
People are saying, "Oh, that's okay. I have a mask on."
Mhm.
I'm in a scooter. So that means most of my scooters in the elevator, and if you're outside the door, you're literally a foot away from me. And now if you get in the elevator, you're a half a foot away from me.
Mhm.
So when I block the door, people get upset. We must continue to socially distance and wear those masks over our nose. That's where we're emitting a lot of the aerosols. That's coming out. You don't have to sneeze. You don't
Mhm.
have to cough. Just breathing. You're
Mhm.
emitting aerosol. So please wear these masks appropriately. Cover your nose
Mhm.
and your mouth.
So there's one other story I want to talk about, and that is what they're saying about what the COVID 19 does to the heart. And so this has been something that we've been seeing more and more information about. Is that it has some tremendously negative effects on the heart, so that even people who have had it and recovered are finding issues. And so this particular article that you see on the screen is in the Atlantic magazine, and it's talking about how researchers are now finding information that is showing how they're finding traces of the COVID 19 genetic material in the heart and actual viral particles within the heart's muscle cells. And what they're finding is that 10 to 30% of hospitalized COVID 19 patients had high levels of a protein that gets released into the blood when the heart's muscle cells are damaged. And so um, these are patients that have been more likely to die than others and not show any sign of heart injury. And so this is a real issue, and we tie this also into, as you recall, earlier in the late spring when we started finding out about the children's disease that was also affecting kids that also had some heart issues as well. And so we continue to tell people that this is not something to be played with. This is a really, really serious disease, and every day we're finding more and more about what it does. We talked about it last week about more and more different areas of the body that they're finding that this disease affects, and it's going to take us a while to figure out all of the long term effects of this. And so the best thing you can do is obviously do everything you can to not catch it, but you need to do everything you can to boost your immune system, because the bottom line is we know if you catch it, you're not going to know about it for you might not know till 10 days, till symptoms start popping up. And so at that point in time, your body is already in the battle. So do you want to send your body into battle with a toy gun, or if you want to send your body in with enough ammunition to win the fight? So the ammunition you send your body to win the fight are these nutrients that we've been talking about: vitamin C, vitamin D, zinc. The reason why we talk about those three nutrients is because they have been shown to be effective in a variety of body systems. So these are nutrients that are central to your body's immune defense. They get into your cells. Zinc gets into the cell and prevents the cells from replicating, the virus from replicating inside the cell. If the virus doesn't replicate, the virus doesn't become a problem. It doesn't become a problem until it continues to go in, grab, and take over your cell's resources, replicate, burst out of those cells, and it keeps doing that over and over again until it basically takes over your body's systems, and eventually your body is not able to function properly. So when your body, this is not the first virus your body has seen. You gotta have to understand your body has been dealing with viruses since the day you were born, and it's been handling your body has handled millions and maybe billions of viruses over the course of your lifetime. So we should not be afraid of this particular one virus if your body is working properly. But if it's not working properly, you have issues. And so, it's time for us to learn more about how these things operate. We're going to be bringing this message home over the course of the next days, weeks, and months. Next week, we want you to join us because we're going to do a very, very thorough breakdown of the COVID 19 pandemic here in New York. We're going to talk about what went right, we're going to talk about what went wrong, and we're going to have some strong commentary about every aspect of this virus, from the governor to the mayor to the Department of Health to our frontline workers. They've all played a role, and many have done some really great things that save lives, and then some have done some things that have not saved lives. We need to be very, very straightforward and honest about these things and really look at them now, because as we started out, the surge is here, and if it's not here in the city yet, we know that something is coming. And so it's time. It's one thing in March, they took us by surprise. So that old saying, fool me once, shame on you, fool me twice, shame on me. So we're not going to get fooled the second time around.
That's right. So I mean, keep in mind that there's a lot of people who perished from this virus who were considered in good health. And that was just someone who didn't have any underlying illnesses, someone who managed to battle off, as Bob said, different viruses that we face throughout our lifetime. But they didn't necessarily have healthy immune systems. And that's the key. Because even with the vaccine has to track it down. It has to figure out which direction it's going in order for it to work. And if it can't find the formula to work in your body, then it's going to be moved. So let's not sit around and wait for that. We have to return back to, if we ever started, we have to go back to sanitizing those frequently touched surfaces. It's a simple process. Get yourself some spray bottles, 1 part bleach, 9 parts water, and just sit it in your kitchen. Sit one in your bathroom. Sit one in your bedroom. You know, and get some, what do they call it, handy wipes. Just go around the house. When you come in, you're going to your kitchen, you're going to the bathroom, you're going to the refrigerator. Just spray down those handles, spray down the spigot, spray down the knobs, and go from room to room, spray them down, and then come back and wipe them. Because if you just spray and wipe, you're just spreading the germs back and forth. Just spray it and let it sit. Go to the next point. Spray it, let it sit. Go back to the beginning and then start wiping. And just make it part of like second nature, you know. Um, and continue to sanitize items. It doesn't take a lot. Just keep a little basin of soapy water in your sink, little bleach, little just detergent, and just wipe your pans down before they go into your closet and your refrigerator. And when you're finished, just do the process again. Wipe it down.
There it is. So, I think that's all we have to cover for today. I want to remind you to join us next week. As I said, we're going to really go. If you thought we went deep on this before, we're going deeper than that. We're going to ask you to share this information. Like us if you're on YouTube, if you're on Facebook. Subscribe, like, share this information. Share this information because someone you know needs to hear this. And get your vitamin D levels tested if you're going to the doctor. Start boosting up your immune system now. Start putting your supplies together now. Make sure you've got enough food in the house, enough water in the house, that if there's another shutdown, you can handle it. It was one thing getting caught by surprise before. If we go into it now and all of a sudden things get shut down and you're not ready for it, that's on you. You
Yeah.
know, you know.
And dollar store flashlights. For some
Mhm,
reason, people think blackouts only take place in the summer.
mhm.
We have a
No,
blackout in my complex. We used to have them every year. The gas explosion was in March. We had the blackout in February. And that building was blacked out. 900 people were blacked out for 3 days. So it can happen. And remember, we are getting ready to go into flu season. We're still in hurricane season until November 1st. So we've got multiple emergencies going on at one time. And
and
it's
like,
also getting cold. And that's a little weird. It's getting very cold already. And we just stepped out of summer. So things are going to change very, very rapidly. And we need you to be on board to be ready for it.
and as we always say, we're not here to scare you. We're here to prepare you. So
Yeah.
get re- get ready. Get ready.
Yeah, it's going to look very different because when this started, we were coming from the winter into spring and summer. Now we're going from summer into the cold months. So back then, even though we started being shut down, even though it was, limited, people were moving around because the weather was getting warmer. But now we're going to be closed in more. People are not going to be moving around. Everybody's going to be inside because it's going to get colder. And that's why you really have to pay attention to your immune system as well as your environment, making sure that you keep your environment, your home, as sterile as you possibly can. And it's really not a lot. So we're not saying you have to go into like you go out and work and now you got to go home and do a full-time job. Spray, 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 wipe, wipe, wipe. And again, if you have children, you have to follow behind those kids, when they use the bathroom. It's just a matter of just starting it. Once you start it, it becomes second nature.
All right, so share the information. Um, we will be back next week, 9:30 a.m. on YouTube, on Facebook. Please get this information out, and take care of yourselves.
Until next time, stay safe.